Mental health is something that's been swept under the rug for years. A lot of people don't want to talk about mental health. They don't want to discuss it. They don't want to have anything to do with thinking anybody that they know that's in their family has any mental health illnesses. But the reality is mental health is real. Today we will discuss 5 mental health disorders that people have and the signs and symptoms in order to recognize them so that you can get help for yourself or someone that needs it. So let's get started. Mental health is defined as a condition that affects a person's thinking, feelings, or mood and impacts them in a negative way. Although everyone has mental health, the ways that it affects people in negative ways is the difference. Let's take a look at 5 of the most known mental illnesses. Number 1, anxiety disorder. I know many of us have heard of this. 18% of people in the United States suffer from a mental health disorder known as anxiety disorder. Over 40 million people have symptoms of this disorder on a yearly basis. And of those 40 million people, only 38% of them will actually get the help that they need. Now, some of those reasons are by choice of not wanting the help, not feeling they need to help, or services not being available to help them. Anxiety disorders are rarely alone. Usually depression is the co-diagnosis. Anxiety disorders come in several varieties. You have panic disorder, social anxiety disorder, and OCD, which is known as obsessive compulsive disorder. All of these disorders come with uncontrollable worry, and it affects almost every aspect of your life. It affects sleep, relationships, school, work, just to name a few. Therapy and medications are usually treatments that help with these anxiety disorders. Number 2, personality disorder. This disorder refers to a person's behavioral, emotional, and thought patterns that deviate from a person's individual culture. 9% of our culture has a personality disorder. These differences they experience must be causing significant amounts of distress in a way that they see themselves, others, or their situations. Number 3, ADHD disorder. This is known as attention deficit hyperactivity disorder. Usually when we think of ADHD, we think of a child that has too much energy, is bouncing off the walls and just cannot focus or finish a particular task for any length of time. But ADHD affects people of all ages and has multiple symptoms like the inability to concentrate, forgetfulness, not being able to sit still, restlessness, and losing things. There are actually 3 types of ADHD. Impulsive hyperactive ADHD, attentive ADHD, and distractible ADHD. Life coach, therapy, as well as medication are some of the ways to treat ADHD. 4, PTSD disorder, which stands for post-traumatic stress disorder. 7% of Americans will experience PTSD at some point in their lives. This is not a disorder that just comes from people who have served in the military, although we hear it more from that standard than a lot of others. A traumatic event is described as an event that should not have happened. May it be physical, mental, or emotional abuse, an accident, or any sudden thing that brings along trauma. Stress is a normal reaction to trauma. But what happens when the threat is gone? Stress and trauma stop on its own for most people. The mind and body have an understanding that the person is no longer at risk or under any sort of attack. But when the mind and body don't get this message, that's when PTSD kicks in and is a longer fight or flight response that happens even after the event is over. Number 5, depression. An estimated 6.5% of the population over 18 in the United States of America suffer from depression. Although an occasional low mood is normal to negative situations, depression entails a low mood that are very severe and can last at least 6 weeks or a lot longer. Depression manifests different in women than in men. Women have feelings of sadness, worthlessness, or guilt. Men tend to mistake the symptoms of depression as fatigue or being easily irritated. Common treatments are cognitive behavioral therapy, interpersonal therapy, psychoeducational groups, antidepressive and brain stimulation therapies. And I also want to throw in one more. One-on-one personal groups are very good for depression. So if you know someone that suffers from any of these mental illnesses or yourself, seek professional help so we can turn this curve of mental illness and start seeing some results and seeing some people becoming more healthier mentally so we can continue to support each other and live in society. If you like anything I said in this video, hit the like button, hit the subscribe button, and I'll be coming back at you with some more mental health. Libra Man out.